You are just driving down that road of labor and then suddenly things stall out. Maybe your contractions go away, or maybe you were actively dilating and then suddenly things just like peter out. What can you do as a patient to help labor to keep going? After seeing thousands of births, and I gotta say, guys, this happens a lot in the hospital, I'm excited that you guys are here so that I can give you my best tips for both early labor and active labor. Okay, the first one would be early labor. So this is defined as 1 to 6-ish, 4 to 6 centimeters. It's really when labor is kind of going slowly. Most often these people are still at home and your cervix isn't particularly actively dilating, which means if I check you now and I check you an hour later, I don't see a whole lot of difference. So that's usually what early labor is defined as. I actually have a whole video on prodromal labor that I would totally recommend checking out. I'm going to link that above or below so that you guys can watch it. But early labor can be a time where a lot of times those contractions just peter out. Now, first off, I want to tell you that this is very normal. It is part of the plan for your uterus to look like it is just like getting going and then boom, false start. Your uterus is going nowhere. And I'm also here to tell you that it is wildly annoying, both pain-wise. It's not fun to have contractions that really don't feel like they're going anywhere, but also emotion-wise, because you feel like, yep, we are getting on the labor path, we are going, and then it stops. And it might even happen like every evening, which is just the worst. Again, watch that video on prodromal labor for more on that, but I want to give you a few tips that you can do if you're in early labor. Now, the first one is to my buddies who are in the hospital in early labor. If you notice, you're there, you have dilated, they say, let's keep you. Usually this is the people that are like 3 to 4 centimeters and we keep them. And then we notice the contractions just sort of peter out. Now at that point, we have sort of 3 options. One, we can see if they happen again, was it just us getting on the monitor, a bolus of fluid, and then your contractions are going to pick back up. Number 2, we can augment you with Pitocin, which is what a lot of people end up picking, but I want to let you know that that is pretty much like an induction, but we call that an augmentation where we're sort of helping your contractions to go along. But the third option is often the best option and not looked at by a lot of people. And I gotta say, a lot of people are going to be like, why don't providers give us that option? Because patients absolutely throw eye daggers at us when we mention you could go home. That's right. If your labor, even if you're admitted to the hospital and you think you're on the labor train and contractions just go away, you do have the option to say, let's see if this happens another day. You can go home. So I just want to put that out there. That is, of course, something that you're going to want to talk with your provider about, all the other circumstances that are going on. How's baby looking on the monitor? Any health issues you or the baby has? It's a whole picture here, but I think we leave going home by the wayside far too often when it really could be helpful and maybe avoid some of these longer inductions that people think aren't inductions. They think they're in labor, but hopefully you understand what I'm saying here. Think about going home. It can be a great option if this happens to you in early labor. Now, if you're like, Hillary, what the heck is going to happen at home? Let's say your contractions, just are a little bit further apart. At home, you're allowed to relax, which lets that natural oxytocin, the hormone in our bodies that helps labor go, it lets it just flow through our bodies because you're eating the things that you love. You're in the places where you feel safe. You're being able to make more of your own choices. You're not worrying if you're on the monitor. So home can be a great place to let that oxytocin flow, and then maybe something will kick in and you'll go into labor on your own. And either way, you can sit there and eat good brownies rather than the nasty ham sandwich that's probably 3 days old that's in my fridge. I pick the brownie. Okay, here's another one that people side-eye me when I say, but studies have shown that this puts people into labor quicker than if they had not done it. And this is over a wide swath of people. So I'm telling you that it did not work for everyone in the study, but it might end up working for you. And that is nipple stimulation. Now you can use your pump if you already have a pump, or you can use your hands. By the way, most people in the United States, you can get a pump for free. I'm going to put some information for that down below. But nipple stimulation has been shown that it might just give you that little push that you need to really get into active labor. Now, again, it's not going to work for everybody, but if you think it's worth a try because kind of a low effort there, it could be an option for you. I have a whole video on if pumping will put you into labor, so I'm going to link that again up above or down below so you guys can check that one out for more information on this topic. And make sure that you're talking with your provider before you do this, because there are some considerations, because sometimes you can make your uterus contract a little bit too much. The good news is if you stop, it should go away, but you want to know those things to watch for while you are trying this out at home. These aren't things you want to do in secret with your providers. You want to let your providers know that you're doing them so that you can do them safely. That does not mean that your provider is going to say, yeah, that's a great idea, because a lot of them are worried about liability. If you were to do this at home and they encouraged you to do it at home and your uterus hyperstimulated, you could blame them, but letting them know, getting those things to watch for is important. Okay, moving into active labor. So this means that your cervix has been actively dilating, and usually this isn't the contractions petering out. This is more of babies just not moving into the birth canal anymore. What can you be doing? And the first one, and everyone's favorite, is movement. I was reading an old-timey midwife book, and the new midwife was on. The experienced midwife couldn't be there. She was at a labor. She could not get this lady's baby to descend into the birth canal, called the experienced midwife. The experienced midwife said, get her up. And I was like, yeah, that's what we do. And it happens exactly the same way today. Experienced labor nurses will say motion is lotion, because it really helps baby to find their best way into the, oh my gosh, this baby's, the placenta just fell off. It just find their best way into the birth canal. And as you can imagine, because there are ligaments and other things in this area, sometimes that takes a little bit of motion. We're using gravity to help us kind of move baby's head to find their best spot. And motion is the big winner. Nobody freak out. I found the placenta. Okay. I think movement is so important that I actually have a whole set of labor movement cards in the online prenatal class for couples. They are great for partners or you to flip through as you're deciding what's best for you to do during labor. I'm going to put the link for that class down below so you guys can grab those. But today I want to share 4 of my favorite ways to move during labor. And the first one is something I absolutely hate as a girl who just did a YouTube workout, and it is lunges. There is something about your body moving in different ways. As you can imagine with this pelvis, when things are kind of moving like this, it doesn't move like that. I mean, it shouldn't, but it really helps baby to maybe slip down and find their best way. Now you're thinking, Hillary, I can't do lunges. Let me give you a couple of options. The first one is if you are able to be off the monitors or walk the hallways, usually along the side wall of the hospital, there's a little bar that you can hold on to. Now that bar is there because we run beds into the wall sometimes, but you can hold on to it and do your lunges and then turn around and do lunges on the way back. I've had patients in triage who, when they took my go do some lunges in the hallway really seriously, I saw great cervical dilation from them. So I'm here to tell you both that lunges absolutely suck, but they can be really helpful. Now, if you have to stay in the room, by the way, I have a whole video on wired versus wireless monitoring that you guys might want to check out. I'll put that link down below. You can just be at the bedside and hold on to the side rail and still do lunges. You can do forward lunges, you can do backward lunges, you can even do side lunges. It's just really nice to have something standing there to make sure that it's steadying you, because you're pregnant, your balance is a little tricky, you're also in pain. So I love having something by you. If you really can't find anything, you can always use your partner, but I think it's nice to have something that's maybe a little more stable than somebody's arm when you're doing lunges. And I'm not saying you got to do these for hours. Even if you just did like 5 minutes of lunges, or you did 30 seconds every 5 minutes of lunges, I think that's a big win, because I'm also here to say they are not my favorite exercise. And these people are not like lunging till their knee touches the ground. They're just doing the basic motions that feels okay to them. I don't want you to like overstrain yourself doing lunges. Ever. Okay, the next one is squatting. Now you can do just those up and down squats like Hillary was doing in her workout today. Another option is to sort of just rest in a squatting position. Now, most of us are not great at holding a low squat for a long period of time. If you are, hats off to you. I am not you. But things we can do is just sort of rest our tailbone or the edge of our bottom on, you can do it on a stool. Most labor and delivery rooms have a stool in the room, not the doctor's stool. It's a lower one that we sometimes use in a shoulder dystocia situation. Of course, cover it up with a chucks, but you can kind of just squat in a lower position. It's going to put you, 6 inches off of the ground. Those legs are going to be out in a similar squatting position, and hopefully baby can find their way out. Now, if that does not compel you to be in a squat, another option is that that the foot of a labor bed normally will lower. And again, you can just kind of sit your tailbone on the bed and keep your feet in that squat position without actually having to hold yourself up. Some hospitals will have a squatting bar that you can kind of slide in that you can hold on to. If that is not an option, I would recommend, having your partner near you at the bedside while you're doing this to make sure that if you have any unsteadiness that they're there to help you feel a little bit more steady. Sometimes side rails can come up, or there could be a handle that you can hold on to as well. If you're feeling unsteady, tell your nurse there might be something on the bed that she can use to help you stay steady if you're doing a squat in the bed. And again, I don't want you to do this to the point that it hurts. I don't think you should be holding a squat position super long because it can be not great for our muscles and ligaments. But holding it for a period of time that feels comfortable for you can be a big win. Okay, this next one, guys, I'm gonna get up on my stool. Okay, I call this one the Captain Morgan. So you're gonna lower your bed and then you're gonna put your foot up on the bed. You wanna do it on the bed, not the doctor's stool, because you need something that's stable. And then you're gonna stand here like your Captain Morgan. Now you can you can turn in this position, which really helps to open up those hip flexors. And you're not going to hold this for a long period of time. And then obviously you're going to switch sides. But I think the Captain Morgan, especially like bending into it a little bit, can be really helpful. Now, why is that the case? First off, that's sort of like a squat on one side. But also, as you're in labor, your whole body sort of tenses up, right? And your uterus and your pelvic muscles also want to get on that game. They're like, oh, this is the worst. I hate being in pain. And so sometimes they just really contract and they get really tight. And so doing that Captain Morgan really helps to stretch out, especially your inner thigh, which is sort of difficult to stretch out. So you can do that on the bed. You can also do that sort of on a labor ball as you're stretching side to side if you find that more comfortable, although I'm a big fan of the standing at the bedside one. You can also do it on the doctor's stool. And in that post on wired versus wireless monitoring, I go over how much I love the doctor's stool and using it in the room as a tool. You guys can check that video out if you want more information on that. Okay, and this last one, not so much about movement, but a lot of people find it helpful. And so I wanted to put it out there. And it is going to the toilet and sitting on it backwards. And so, if you sat on it forwards, it does feel good. But sometimes you just kind of collapse, you're resting on your knees. Not as good as if you are able to sort of rest on the back of the toilet. It makes you feel a little bit more stable. And there's something about having that opening around the birth canal that just feels really good. So if nothing else is working, you can't rest in the bed, that can be a great rest position. As a note, most people's monitor cords will not reach to the toilet. So your nurse is not going to want you to hang out in there for a long time if you are having continuous monitoring. So that's something to think about as well. So yeah, pretty glamorous. Just go hang out on the toilet, Hillary. Yeah, go ahead and like this video and subscribe because I'm giving the good tips here. But I got to tell you, it feels so good to sit on the toilet. And that sounds insane to you right now, but it really is a top-notch tip. Okay, what's the next thing you can do? And I'm here to tell you, you can ask your nurse. Sometimes nurses have been shot down at telling patients to move to the point that they don't want to even bring it up, right? And so if you ask your nurse, she might have some ideas. So when we check your cervix, a lot of times we can tell which way baby, if they were to turn, would better, descend into the birth canal. But again, timid nurses might not be like, hey, it's time to lay on your left side. They might sort of be waiting for you to ask. So if you ask your nurse, hey, things just aren't progressing. Do you think I could lay on one side or the other and make things go? And if they're like, I have no idea, say, hey, is there anyone on your unit that's great at figuring out which way to lay to get the baby to descend? For me, it was my friend Cheryl. She was absolutely great at getting patients in a position to let that baby just descend. I learned so much from her, and ultimately I got to be one of those great positioners as well. But first off, if you have an epidural, it's really hard for your nurse to move you well on their own. So if your partner can help out, that's amazing. But if we can get our good friend Cheryl in the room to help us position you correctly, that can be awesome as well. Remember, as labor nurses, we work as a team. There's things that some nurses are good at and other nurses are better at other things. And so the good news is that we can use our skills to really help each other out. So ask your nurse. It helps them feel as a valued member of the team when you say, hey, what do you think I should be doing? You're respecting the fact that they've been in there, they have experience. What could they be helping you out with? And yes, I agree. In a perfect world, your nurse is in there giving you all her ideas without your request, but life goes on. Okay, this next one is something that not a lot of people talk about. Again, as a nurse, when you come to the hospital, we get a diet order, and that means what you can and cannot eat. But sometimes eating something can really give your body that energy and the glucose that your uterus needs to really contract and give good contractions to push that baby into the birth canal. This is especially true if you have been in labor for a long time. I'm looking at you with my long induction moms. Now, your nurse has to abide by whatever the doctor's orders are. So if they say no fluid, no nothing by mouth, your nurse cannot give you anything by mouth. If they say only clear liquids, your nurse can only give you clear liquids, which includes juice. And sometimes we have like little ices that I think can be really awesome. Now, I'm not here to say go get a foot-long Subway sandwich, because high deli meat. But I am here to say that a little snack, a little sugar, even just juice can give you that sugar that you need to get your uterus going. Now, if you're diabetic, it gets really tricky because you need something to help you get going. Some hospitals have like a clear protein that you could eat, although I think it's absolutely disgusting. So this is definitely a conversation that you have with your care team, but it is 100% valid to say, I feel like if I ate something, I could really give my uterus the energy to contract and get this baby to go down. Now, there has been a study recently where it showed that we can turn Pitocin off and your body should continue contracting. Take that for what it's worth, but it can be part of the discussion to where you just give me some sugar, people. My body needs some sugar to keep going, and I'm running this marathon. So eat something. There have also been studies that have shown that Tums sometimes help that uterus to go because potassium and calcium are used in muscle contraction. But I've also seen studies that contradicted that. So again, use your expert team. They're an expert on you and an expert on your circumstances, and see if a little food or juice could be something that could help your uterus get the energy it needs to push that baby into the birth canal. Because I think far too often we starve these poor uteruses in labor. Okay, this next one is not what Hillary thinks of first when I'm in a tragic situation. And it is to chill out or nap. Because Hillary always thinks that I can like work through a situation, but the reality is a watch pot never boils. And I feel like a watched pregnant woman never dilates sometimes. Some hospitals check your cervix every hour. Like, not a fan of that, but some of them do it. Some patients want us to check them every hour. And maybe we just need to like chill out, give your body a little bit of time for it to do its thing. Now, if you have an epidural, I hope you get a nap. When I get my patients an epidural, I love to give them that first hour, half hour, however long they can to have a nap, because I think it helps your body to relax, and then that baby can just slide into the birth canal. It is like the chef's kiss of an epidural. So taking a nap after your epidural, big win. Or, if you've been in labor for a long time, you can ask for like a little bit of extra epidural so that you can not feel anything and get that nap in. Sometimes they give you a little button you can push, and that would be enough. Now, if you don't have an epidural and you're miserable with your contractions, this could be a time that you ask for IV pain medication. Now, they will not give that to you if you are real close to delivering. So that is, again, a conversation that you have with your healthcare team. Remember, IV pain medication sort of just takes the edge off of pain. But I have had patients who are able to sleep even in between contractions. And that can be a big win that just helps your body relax and let that baby descend into the birth canal. If you guys are interested on a video just about IV pain medication and how we use it effectively, tell me down in the comments, because I think it's a little bit misunderstood, but can be extremely helpful in situations like this. Another thing to think of is if you are just miserable with the contractions, maybe an epidural is going to help you relax and help that baby to descend. It can be the tool that we use to help baby come into your pelvis because you physically just cannot relax because the pain is so much. So I think that's a good thing to think about. You might have planned for a natural delivery, but things are not progressing. An epidural can be a good option for you at that point as well. Again, another conversation to have with your whole healthcare team. Okay, this next one is a new prop. You'll notice in the initial one, I did not talk about peanut balls, but they are a great thing that people can use to help their cervix to dilate. So a peanut ball looks just like a giant Mr. Peanut. In fact, at one of my hospitals, somebody Sharpied Mr. Peanut on the peanut ball. I don't know why. It seemed a little bit creepy, but it's just a big peanut that goes between your legs. If you're like, what the heck is that? I'm going to put a link for a peanut ball down below so you know what they look like. But changing the prop. So going from a peanut ball to maybe even using a yoga ball between your legs, or changing how you use the peanut ball. You can have it between your thighs, or you can have it between your knees, or you can have it between your ankles to kind of cave in your legs. So changing the prop, moving the prop can be really helpful. And these are small movements that can also be, used while you're having rest. I think these things are most helpful when you have an epidural, although if you want to rest, especially if you've had IV pain medication, a peanut ball, yoga ball can be really helpful. Now, I have been a nurse since God was a boy, and so we didn't have peanut balls when we started. So there are still other things you can use in the room. Like I said, the doctor's stool or the stool that people use to squat on. I would just wrap it up in chucks and use it to help position my patients in the hospital as well. So ask your nurse, is there a peanut ball that we use? Are there other props that we can be using? That can be a great way to help labor progress. And I think asking your hospital if they have peanut balls is a great thing to do at your hospital tour. I recommend everybody take a hospital tour, because the good news is an actual peanut ball is not that expensive. If you don't end up using it, maybe you could donate it to the hospital or to a pregnant friend, but you could have one on hand if the hospital doesn't have any, because after COVID, a lot of hospitals got really weird about it. I don't know. So yeah. And if you're loving insider tips like this, first off, I want to say that I'm so glad that you're here, but these tips are important for your partner to have too. So if you're thinking, I wish my partner could get more information like this, I'm going to put a resource that helps you prepare with your partner. It's called the Online Prenatal Class for Couples. I'm going to put the link down below. Okay, finally, this video is getting so long. What do you do if your doctor is like, I'm calling this failure to progress, you need a C-section? And I mean, that's their right to say. A lot of people at this point in time are begging for a C-section. So if your provider offers a C-section, remember, there are people out there who are like, yes, I want to take that golden ring and I want to get out of labor. I am done with this. But you have to decide what's important to you. And I think you can do that when you create a birth plan. I have a whole free birth plan series that I'm going to put down below called Birth Plans Made Easy. But knowing what's important to you at that moment, because you may turn into one of those people that's like, I'm done with labor, let's get this baby out, even though you were anti-C-section the whole time, and that is okay. But if you're thinking, no, I'm looking okay, you can ask your provider, am I looking okay? Is baby looking okay? And if both of those answers are yes, then you really have free reign to keep trying different positions, changing things, getting an epidural, trying IV pain medication, whatever is going on, to see if you can get baby to progress into the birth canal. Failure to progress was one of my most frustrating things with providers. And a lot of times they would come in at, lunch or after surgery, and they would say, if she's not 8 by 4 p.m., I'm going to section her. He would just say that as he walked out the door. And I'd just be like, whatever. But I hate how they put a clock on you sometimes. And I'm here to remind you that it is always your choice. It is not the provider's choice to section you at 4 p.m. Now, if you or baby is not looking good, it could be something like, baby's had some cord compression in the birth canal because of how they're facing, or you're starting to get a fever. Now, that is a whole different situation than just baby doesn't seem to be descending. Now, that I will give you the caveat that there are people who baby does not descend into the birth canal, and baby would never descend into the birth canal. That could just be the way that they're wonky in the pelvis, or something else is going on with their pelvis, but those people will end up needing a C-section either way. So you could still put in all the effort of changing positions and doing all these things and end up with a C-section, or you might have a successful vaginal delivery. And I would just let your nurse know what's really important to you so that they can help you do that. And if you're getting close to a shift change, be sure, it's never a bad thing to say, hey, when do you get off? Your nurse isn't going to be bugged by that. Or when do we change nurses? If you're getting close to a shift change, I would ask your nurse, can you make sure to give me somebody who's awesome? There are nurses who've taken a class called Spinning Babies, but they're awesome at positioning to help baby descend. And they can ask the charge nurse to kind of put you with a person to help you have the birth that you're hoping for. And that is another great pro tip. Okay, if you are still 36 weeks and you're thinking, oh, how the heck can I prevent this? I actually have a whole video on preparing your cervix before labor that I'm going to put up above. It's super important. I'm so glad that you guys are here joining me at the Pregnancy Nurse, where we get you prepared, not scared, for your upcoming hospital birth.